Acting Health Minister Mmamoloko Kubayi-Ngubane has confirmed that the highly infectious Delta variant of COVID-19 is likely behind the surge of the new cases that we have been seeing in the country. And new data then shows that the variant is rapidly becoming the dominant one in South Africa. In a media briefing earlier today, the minister reiterated that South Africa is now in a third wave. To talk more on this, we're joined by the co-chair of the Ministerial Advisory Council, Professor Koleka Mlisana. Prof, good evening, and thank you so much for your time tonight. Let's talk then about this Delta variant. You gave the media an extensive briefing this afternoon. How much of a concern is this variant?
Good evening, Bongi, and good evening to all the viewers. Yes, actually, we had a briefing earlier today, and it is a great concern, deep concern, actually. If I can just take, the nation through very briefly, you will remember that when we actually had put out consideration for a potential third wave, the modeling team always talked about, in the absence of a new variant, this and this and this should happen. Because, when there was no new variant, then there was a prediction as to what is likely to happen. We'll be looking at the behavior, we'll be looking at, how much we would expect of infections to occur, which would just depend on the previous exposure. But then what we now are discovering is that, as everybody is aware, that there are four variants of concern globally. The one that was discovered here is the Beta variant. The one that was discovered in UK is Alpha. Then Gamma was discovered first in Brazil. And the Delta, which we're talking about right now, was first discovered in India. So what the data that has come out is that now in the country, we do have the Delta variant. And actually, when we look at the characteristics of this variant, it actually fits in very well with the rapidly increasing numbers that we're seeing. Because what we know about this variant is that at the moment, it actually is detected in 85 countries. And it actually, in the countries where it has been seen, it seems to overtake whatever variants are there. Characteristics of it is that it is shown to be highly transmissible, and it seems now to be more transmissible than all the other variants, including the Beta variant. What about disease severity? There is not much evidence as yet, but it might actually have an increased severity in disease, so we're going to have to wait and see. And there's also a concern that because it actually reduces, we've seen reduction in neutralization with serum of individuals that have been infected by the Beta variant, which means people who would have been infected by the Beta variant, which was circulating in the country, have now got a risk of reinfection. And so all these characteristics are saying to us, now that we are seeing this variant, and this data was actually presented earlier this morning to the acting Minister of Health, and I think later to the President as well, because of the data that we have seen coming from KZN, where in KZN, as you know, that we've been doing this genomic surveillance. And actually, what Professor Tulio de Oliveira's lab did, they actually tested, selected a random, samples from the various districts in KwaZulu-Natal. And when then they actually analyzed and did genome sequencing, it showed that there's actually more than 60% of those viruses are actually the Delta variant, which means the Delta variant is quickly overtaking the Beta variant that we have been seeing all along. But what I want to just highlight as well is that we are still waiting for Gauteng data, and we should have that in the next day or two. So we really think these high numbers are as a result of the Delta variant.
Let's talk then about, what you've just presented to us. I'd like to start first with some of the districts then in KwaZulu-Natal. If you're able to share with us which are some of these districts that you were able to do the sampling in.
Okay, so the sampling was actually done across 6 districts in KZN, the Herikwala district, Zululand district, Ilembe district, eThekwini, King Cetshwayo, and Ugu, which really represents, the almost all, the whole of KwaZulu-Natal. And you can see that these are, these are districts that are both rural and urban, and we're already seeing this variant in those districts.
Let's talk about, this Delta variant. I wonder then, because when we look at the situation in India, you say that it's currently in to 85 countries. Let's talk about whether or not is this the same Delta variant that was found in India. We know that India right now is dealing with a Delta plus variant, but we saw before talks of a Delta variant. Is this the same one?
Yes, it is, and it is the same Delta variant that has actually, spread across the globe, and we have seen the same characteristics of, increased transmissibility. And in fact, we are seeing the same Delta variant even in countries that are way ahead insofar as vaccination is concerned.
And when you then look at the symptoms that are then presented by a person who has this Delta variant, are they any different to what we saw in the Alpha, the Beta, as well as the Gamma?
Okay, so most of the data actually that, about this variant is coming from the UK. And, in what we're seeing is that it looks like there might be a different clinical presentation where we're seeing mostly headaches, sore throat, runny nose and sneezing, as opposed to lower respiratory tract, as symptoms. So there might be a slight difference in the clinical presentation, and that's what we therefore need to just look out for.
And also now we're seeing Gauteng as the epicenter. I mean, cases even yesterday reaching 11,777. Should other provinces be worried that they may find themselves in the position that Gauteng is in? Or are we going to see more of a concern around Gauteng and not so much other provinces?
Oh, no, I mean, the fact that the data that, was shown by Professor De Oliveira was actually from KZN, it means, the variant is probably in every other province. And so it's going to be very, very important for each and every province to be on the lookout. And in fact, when we look at the numbers, and everybody will remember, you will recall just how, the numbers in Gauteng shot up in a matter of days. And so we are expecting a similar situation in the other provinces as well.
And when you then look at this current situation, I know you said earlier that you as the committee now are calling for as the council are calling for stricter measures in order to curb movement, because that is also the biggest concern that there is. And there's also social gatherings that we have seen, and people still not adhering to some of the safety protocols. What advice then have you given to the Command Council around what measures should they be looking into implementing?
Okay, so we are actually submitting, an advisory to the acting Minister of Health as I speak. But I mean, just looking at the behavior of this variant, it is clear that if we're looking at it having this high transmissibility, we then need to look at what measures, what interventions do we need to take to reduce the increased transmission. What measures do we need to take, insofar as the disease severity, because then it means we're likely to have increased hospital admissions. And so insofar as increased transmission, it's going to be important for the country, for us to be able to reduce transmission. We've got to enforce hard restrictions on movement and gatherings. As to what that ultimately pans out to, we will specify, our views to the minister. But otherwise, there's a definite need to make sure that this is, restrictions are enforced on movement as well as gatherings. And then insofar as disease severity and the anticipated increase in hospital admissions, we already are seeing this, that the healthcare facilities are already overwhelmed. Therefore, we're going to need to look at what are some of the interventions then that are going to actually ease and relieve the pressure on the, healthcare facilities. And also we need to ensure that, there's an implementation, and this is what we've been saying all along, that there's got to be, the comprehensive surge facility readiness plan and strategy has got to kick in all provinces. And I think the point that we really need to stress about this is that all provinces have got to get ready and have plans in place, for increase in hospital admissions. And thirdly, which I think is important as well, which is important as well, we do need to actually continue with ramping up vaccinations. So whilst we're looking at, reducing, or restricting movement, we need to then find ways, how do we continue, with vaccination? Obviously, it's got to be under strict adherence to the non-pharmaceutical interventions and the, infection and prevention control protocols.
And Prof, some people have been saying that those who've managed to get the vaccine have been saying, no, I've been vaccinated, so there's absolutely no need for me to now be careful. What do you say to those tonight?
Okay, so insofar as vaccination is concerned, we have been saying this, that firstly, depending on whether you've got the Johnson & Johnson vaccine or you have been vaccinated using the Pfizer vaccine. If it's the Johnson & Johnson vaccine, because it is a single-dose vaccine, we are saying we see good levels of protection beyond 28 days, which means even if you have been, vaccinated, you still need to adhere to the, to the intervention, to the non-pharmaceutical interventions. And in fact, when you are vaccinated, as to how long the, the immunity is going to last, we still don't know that. And for as long as the majority of South Africans are not vaccinated, you still actually are at risk, remembering that the vaccines actually have shown good efficacy against severe disease and death. So I'm talking about the single dose of J&J, but if you're looking at the Pfizer vaccine, because it's 2 doses, in fact, now that we have the Delta variant, we seem to have the Delta variant circulating. When we look at data that has come on vaccinations, we see that for the first dose of the vaccine, the efficacy was only up to just about 1/3, and it was only after the second dose where there was good, good efficacy above 95% for the Pfizer vaccine. So it means for people who have just had the first dose, they still need to make sure, just like J&J, they still to make sure that they actually are adhering to the non-pharmaceutical interventions. And even beyond the second dose, for as long as we don't have herd immunity, we're going to have to continue adhering to these interventions.
And as you said then, that those who had the beta variant also need to also be careful because there's a chance of reinfection.
Exactly, yeah.
Okay, and Prof, as we round up our discussion, final question from me. The President is addressing the nation tomorrow. What are you hoping to hear?
Well, I'm hoping to hear very clear message, a very clear message on how we're going to enforce hard restrictions on movement and gatherings, and also very clearly how we're going to ensure that we're prepared for the increase, in hospital admissions. So what is actually going to be, what are the provinces going to do to ensure that, they are ready for this increase in hospitalizations? And hopefully, if we can do that, then we'll be able to actually avert a number of deaths.
Prof, thank you so much for your time. Certainly, that was insightful. We do appreciate it here on News at Prime. That was the co-chair of the Ministerial Advisory Council, Professor Koleka Mlisana.